Welcome back to another Senior Learning Institute's educational moment, where older adults and their loved ones turn for honest and straightforward information. In just a few minutes, you'll enjoy bite-sized, easily digestible nuggets of knowledge, empowering you to make the right decision the first time. So without further ado, here's our founder, certified senior advisor, seniors real estate specialist, nationally syndicated podcaster and speaker, the advocate you can trust, Mr. Ted Gottlieb.
1, 2, 3. Through consultation, assessment, care coordination, and advocacy, care managers work with clients and their advocates to address their challenges. One of the most competent care managers I know is Sharon Gorman. Sharon is the owner of Certified Care Management. Sharon, as we speak, the world is dealing with COVID-19 pandemic. How are you as a care manager assisting during these uncertain times?
Uncertain is right. There's been just literally daily changes. So sometimes it means a caregiver who has concerns that they may have been infected can no longer go to a client that they, are an important part of, and I need to replace that with a caregiver who's capable of going in. Sometimes that means that someone was hospitalized and have to help the family deal with it. A couple examples are there is a woman who had a stroke. She's in her 70s, not old, and she's in a skilled community, and she is not with her family. And so they've made the decision to bring her home with 24-hour care so they can be with her. And it's, she's been married for however many years and has kids here, and that I think that's a good decision for them, and it's doable. So it's kind of stuff like that. Just keeping things going, but there's more things happening.
Right. You and I had a conversation before we started to chat on Zoom about the term essential provider, and there seems to be questions about who qualifies as an essential provider. Can you clarify that for us and share how these essential providers add value?
Yeah, absolutely. First of all, if you're an essential provider, you know it. If you don't know, there are lists available through the CDC or your local government that can list, because it does include people who work in grocery stores, who are able to go to work. We've been instructed in the healthcare field to arm all of the caregivers who are going into homes, who are going into communities, with a letter on appropriate letterhead, whoever has, is representing them, stating that they are an essential caregiver. I don't think people will be stopped during the day when grocery stores are open, but if someone's coming home at 9:00 at night, they may be stopped and asked if they are, breaking a stay-at-home order, which I think is a little fuzzy in Missouri anyway. So even when you're essential, you're asked to follow protocol and use social distancing, gloves, masks, watch your temperature, all those sort of things. But you ask yourself each day, is what I'm doing essential? But yeah, we're given a pass to do what we need to do.
Right. Now, we were talking a little bit earlier about how you're needing to go in and do some things that you hadn't done before, and attorneys right now may not be considered to be essential. Is that the case?
hmm Yeah, I mean, all of us are doing a lot of um, parking lot deals, like really people are signing documents on the hoods of cars with gloves on or holding their own pen or whatever might be, just to try with as much information as we have to do the right thing. I have this week going, paperwork is being sent to me. I'm going to a client's home. He is absolutely vulnerable, cancer survivor, of age, and his wife has issues as well, but they have to sign some documents that we didn't think we were in a rush for, but really need to get done now. So I'll go in, hand them the documents, give them my phone so they can have a FaceTime conversation with their lawyer. And then I'll step in the other room while they have that, so they have confidentiality, and then I'll come back in and take the paperwork with me. I know that there's work to try to get, especially elder lawyers, some emergency legislation to try to be able to assist with this, because more people are wanting to make sure they have their, especially living will and estate documents in place. So, yeah.
We're speaking with Certified Care Manager Sharon Gorman. Sharon, how are senior living communities managing outside caregivers, and also along those lines, people, family, and friends who want to come in and visit?
There was, protocol and information that was given to all of them, and they're all adapting similarly, but also taking it a case by case scenario. There were caregivers I had going in to see clients in communities who were straight up companions. They went on outings with them, they had lunch with them, and I do think they're suffering without them, but that is okay to not put anyone at risk. But there are caregivers who are providing extra care, even in assisted living, that is absolutely essential, or the person will fall, be hospitalized, have problems. Hospice is, you can't deny their caregivers, and there are exceptions being made for family. Again, case by case scenario. Typically, when I walk into a community, I go through the back door. They have a sheet you sign that has about 4 or 5 questions. Have you traveled out of the country? Do you know anyone who's been exposed? Do you have any of these particular symptoms? And then they take your temperature. You wipe your hands with alcohol, and you go in. And it's a good stop and ask. And it's hard. People need to go to work, but they also can't expose their family. So I think there's a lot of really good cooperation. I feel that the caregivers who are going in from the outside into communities to directly assist one client are safer than those who work for the communities and are going from, resident to resident. Most of the communities now are having, in the hallway, you wear gloves or a mask. You can take your mask down when you go in a room, or leave it on. But, they're all ramping it up regularly. So.
Right. Are you finding that the in-home caregivers that are maybe going into mom and dad's home residence versus in the community itself, are they also taking these precautions as well?
Yeah, and the families have made changes. For instance, a couple of them have switched to, they used to have 2 8-hour shifts. Now they're having like a 12-hour shift, and one of the family members who's off work go in at night, so to save money, to reduce, any exposure, those type of steps are being made. They're all my instruction is, the minute that you walk in the home, wash your hands, and of course take your temperature and use the precautions. However, the reason for doing that first is because they touched the elevator button or a doorknob getting in, or a gas pump on the way to work. So even though they're clean going in, they need to start off with the proper hand washing. And, we're just constantly trying to give support. Like I said, we prepared letters. So anything I give to the caregivers who are working privately in these homes, I give to the clients, so they know what rules are being followed. And I think information is really empowering. And so just doing our best to provide that.
That's great. Well, Sharon, thank you for your insight. What's the best way for someone to get in touch with you? You got a phone number?
Yeah. Oh, shameless promotion. Yeah, 314-517-5944. Or they can look on my website, which is certifiedcm.com.
That's great. So 314-517-5944 or certifiedcm.com.
Yeah.
Thank you very much again. I want to thank the listeners for listening to this Senior Learning Institute educational moment. At the Senior Learning Institute, we provide the timely, straightforward, and unbiased information you need to make smart decisions the first time. We're here to connect older adults and their advocates with the professionals they seek at no cost or obligation. Folks from aging in place, estate and financial planning, care management, choosing the right senior living community, movers, estates, junk removal, and even selling the home, no matter its condition, anywhere in the U.S. To learn more, please visit us at theseniorlearninginstitute.com. Until next time, I'm Ted Gottlieb, certified senior advisor, seniors real estate specialist, and founder of the Senior Learning Institute.